questions about the budget?
Next quarter we'll have that. So it might be district,
Any questions?
I'll ask one. So, the HFI, funding for our 2024, how does that look? Are we budgeted out and it look like it's gonna be spent by the end of the year?
Yes, there'll be money left over, and again, that's due to when you write a grant, you write in the insurance for the grant, you can't write it in for a single person or a couple, you have to write it in as a family. And there are several people on the grant that are on their spouse's insurance, or they're using single-person insurance. And so that's where we're gonna have some leftover funds, and then when we get the carryover guidance from IDOH, we'll know how to use them, and then take a new request in front of the council come January, hopefully have it on the Sunshine Meeting agenda for February, because January is a reorganizational meeting.
So those funds will be available possibly early 2025 after the state tells us how to spend them.
Yes, we'll know by the first week of January how much is left over. And then there's a Sunshine Meeting that's always the first Tuesday of the month, so it'll be the first Tuesday of February, with the second Tuesday being the voting meeting, and then the funds open up to whichever entity they're appropriated to.
Okay, thank you.
All right. Anything else regarding the budget? All right. Dr. Bracken, your report?
Nothing really to report out of the usual, and, we're working remotely through this wonderful office and things like that, and business as it comes up. To the group here.
Great.
No more COVID? No, we still have COVID hospitalizations. Thankfully, we're not seeing COVID deaths. Have the super aged folks, susceptible patients. That take good hydration. Yeah. Been good. Amy, I don't know how your guys' hospitalization rate, even in here or there.
Yeah, I believe it's just a few here and there, but nothing like ICU or anything like that level,
Yeah.
without other multiple comorbidities.
Still testing like crazy, everybody that comes through with sniffles or any, getting some random tests, just popping up on their haymakers, just of your ankle. Things are related.
All right, Joni.
Okay, I had Scott Swan from IT add a link on our website to HFI, and that link includes our work plan, our 2004 budget, the county scorecard. It has a section for contracts, so any contract that we have has to be posted 30 days with an outside entity on the website. And then any new position that comes on that's HFI funded has to go on there for 30 days also. So that way, anybody that wants to see in the community what's going on with HFI, they can click on that link, and it also takes them to the state link and gives them the background on HFI and the core services and all this, any information that anyone would want to know.
That's
And if
great.
there's anything else that you could ever think that needs to be added that you think would be helpful to the public, just give me a shout out, and Scott can do it. Okay, so, you can do it, Scott. So we met in April, it was Dr. Brucken, Mandy Puller, Dr. Caddick, Jimmy, Mayor Sackbun, Deputy Auditor Cheryl Loudermilk, Council President Todd Thacker, and Commissioner Mark Klinkenbeard, looking over how to plan out distributing the rest of the funds that hadn't been identified for HFI. And Dr. Caddick and Hisham Rahmouni and I had an additional meeting to firm up a plan for it. And we've met all of our deadlines on HFI budget submission for 2005, all of our data tracker entry and core services status. We continue our monthly meetings with the State Department of Health and with their regional team I also had an opportunity to meet with Mark Casanova, CEO of Regional Hospital, and they're wanting to do more community planning, especially with looking at the acquisition, pending acquisition. And so far, his staff has reached out to Chelsea about participating in a back-to-school event that we're doing with the school corporation and their staff, their nursing staff. Autumn Finner's here today. She had the opportunity to come shadow at the health department for a whole day, and I feel that she left with a really good experience, and that is always open to anybody that would like to do that, just to spend a day with us. I thought it would be interesting to ask Representatives Paff and Greg Good, if they would like to come and do a day at the health department, seeing that they're two people that can pack back information to their co-legislators on how those HFI funds are working in our county. So I've emailed Tanya, and I'm waiting to hear back from Greg. So Molly and I got to go to federal court first week of June, and on behalf of the jail's overcrowding federal lawsuit, ACL lawsuit. We went in front of Judge Jane Magnus Stinson. Two of our county council members are here also. They were there. She was very complimentary of what we're doing, especially starting with the program with the school corporation, family court, working with kids, because she said so often you start working with them once they're incarcerated in the system. So trying to get life skills and coping skills prior to, and I know that Molly's gonna get up and talk a little bit more about something we're working out with the juvenile center. But she was very impressed with all the programming, whether it's what Judge Mulligan and Gretchen Ettling are doing, and what the health department's doing. So pleasantly pleased, because there was a lot of apprehension going into that meeting for different reasons. And we did our 2005 budget submission for general health fund and HFI for the council, had our budget hearing yesterday, went just fine. And worked with the Parks Department on their bike program, building better bikes. And I think that's really kind of it in a nutshell, the main things I wanted to touch on.
I know the HI5 thing has been a ton of work, so I appreciate all that you all have done for it.
Yep,
'Cause
and I've
it's
said it
not been
before,
easy.
we knew the first year was gonna be a little rocky, and, next year I'm certain that it'll be much better.
Yeah. Any questions or concerns for Joni's report?
So our jail is already overcrowded? Because I worked some in the old jail, and it was, wow, I didn't realize that.
All right, so new business, we need to approve the proposed GHF budget.
As I emailed, there are no substantial changes in our 2025 proposed budget from our 2024 in regards to our general health fund.
Make a motion to approve the action item of the budget?
Okay. All those in favor?
Aye.
Opposed? All right, motion passes. All right, next is the approval of the proposed 2025 HFI fund budget.
And that's where we receive the enhanced funding. We will receive the enhanced funding of double the amount for 2025. And so we looked at expanded programming.
A motion to approve the 2025 fund budget?
All right, all those in favor?
Aye.
And opposed? All right, motion approves. All right, any other new business? All right, I see there's no old business. How about program updates? Mike, vector control.
Good afternoon. We've been pretty busy. Joni was good to me this year, and she gave me a lot of help. And I'd like to start off by thanking those people. Andrew, Katie, Amanda, Shelley. We had 4 young people with us this year too that were just a great experience. Colson and Paul and Emery and Cassidy. They all helped us with our tars and our catch basins. And they knocked them catch basins out like they didn't even exist. What it's like to be young again. It was fantastic. We were distributing 5,200 Skeeter Beater coloring books to the Vigo County elementary schools as well. That was a big hit again this year. We're continuing to take in TARs from the public. We're still catching them and getting them out of the alley and getting any violators that's got them sitting around. We sent in 4 bats for rabies testing. All of them came back negative for rabies. We're doing our light trap program. So far, we have not had any positive pools of mosquitoes, although the state of Indiana has had 15 positive pools of mosquitoes. Vigo County has had 0. That will probably change because, like I told Dr. Turner outside, we still are about 2 inches under normal rainfall. And as long as we're in drought conditions, that makes me a little uneasy. And we'll see how it turns out this year, but we're staying busy, and well, I do appreciate all the help, Joni, and all them guys that helped back there. And that's all I've got. Yeah, everything's going good. I can't ask for better. Any questions?
What those ticks? There's a lot of ticks around.
Yeah, because it's been so wet. It's been wet enough that the tick population has increased.
How do you kill them?
And then, people don't cut the grass and the weeds as often when it's wet. So, again, that leaves harborage for the tick population. So, you see an increase in ticks.
What about Lyme disease?
I don't have any statistics on Lyme disease, Dr. Lim. I didn't even think about checking on it, to be honest with you. I'm sure that we've probably got cases of Lyme disease in Indiana because the number of ticks has risen. In the last meeting, the IVCA meeting that I went to, they kind of talked about that a little bit, about the tick population being increased. So I'm sure we do have some Lyme disease in Indiana.
How do you kill them?
Pardon?
What insecticide are you using to kill ticks?
Pesticide to kill ticks?
Same.
I couldn't recommend anything for you. I could not recommend anything for you. They have some on the market that you can spray around your property, but as far as what the health department does, we don't do anything like that. That would be total, like your exterminators, your Terminex and those guys. I know they do treatment, but what they use, I couldn't tell you. Any other questions? All right, thank you.
Thank you, Mike.
I just want to add that, to be on the National Honor Society, you have to do so much community activities, community service activities. And 2 of the people that we had were North students, and then we had a fellow from South and 1 from West. So it's a good experience for them, and they get to see how public health works.
That's great.
Doctor, is that same timing for like dogs and different animals like? Yeah.
I think one of the guidelines too for Lyme disease is, if someone has Lyme disease, you need to treat them with doxycycline for like 2 weeks. But if someone has a tick bite, they report a tick bite, you don't even see it anymore, there's a spot. you can give a presumed Lyme disease tick bite and treat that person with doxycycline for 1 day, 100 milligrams twice a day. So a presumed tick bite, so when I saw people come in from the farm community, I think I had a tick bite and my wife took it all last night. I gave them a day's worth of doxycycline. They didn't have to treat them for the whole 2 weeks. Because the test for Lyme disease is still not very good, not very sensitive, and you'll get your report back quite a bit later. I think it's only 50% accurate or something. This has gotten better, so we don't have a great blood test for Lyme disease. So sometimes just treat him for a day. I did it. Never had any issues. The old country doctors, and I do mean the old country doctors.
All right. Chelsea?
Hi.
Hi.
On that note, I've only had one case of Lyme disease, and they didn't get the tick from here, so. But, let's see. So, I do have a new nurse that I did bring on last quarter, but she wasn't able to be here. So, Carolyn is back here. I figured I'd let her wave, and that way you guys know her name and face. And let's see, we did start, we are now a regional stat carrier site. So people can bring in samples that need to go to IDOH. And I have a carrier that comes every day, Monday through Friday, to pick up those samples and drive them over to state. So at least we have a direct line instead of waiting on UPS or FedEx, which I know sometimes they don't get there overnight or the same day that you need them to. That went live on Monday. Let's see, we've been to a couple conferences. We have the Back on Track event for the start of school coming up on August 8th, which we partnered with MD Wise and the school corporation. And we have a few more people coming. I expect it to be bigger than last year, which is exciting. We did do the end of the year clinic at Woodrow Wilson. We ended up having about 40 kids come, 95 vaccines given. Turned out to be a fun little event. Let's see, we finally got an AED for the clinic, which has been great. Exciting. Well, for us, I guess. And let's see, that's been about just planning for the new clinic and doing interviews for the school liaison position. So, does anyone have questions?
Chelsea, I saw you had a couple of cases of histoplasmosis listed. Is that pulmonary, or how did that get diagnosed? Do you know?
Our histo is usually pulmonary, usually pneumonia.
Yeah, Jimmy, I don't know if we do washings, or how do we diagnose this stuff? From sputum, I guess?
I think it would have to be with the bronch. Yeah.
I know this is collected at the
Yeah.
state, but do you know anything about our syphilis or HIV levels? Because I know those were increasing.
No, I can't see any of the,
Estimates.
until they get to a level that they want to tell us most of the time.
So we offering COVID vaccines, like boosters and so forth.
Mhm.
Are they free?
No, not anymore.
Medicare, anybody cover them, or people just have to pay cash? Or?
So Medicaid covers them, most of the Medicares cover them, and most of the private insurances cover them. I do have a stock in the BFC program that if they don't have insurance, it's a $10 fee for it. Of course, if they don't have the $10, then we don't charge them for it. And I do have a stock in the Bridge program, which is the adult program that is the same thing roughly as the BFC. It's $10. If they can't cover it, then it's no charge.
Because I've lost track of the guidelines. Is it an annual booster vaccine now?
Pretty much, yep.
Is it still more high-risk people like me?
It's gone to an annual. I'm waiting for the new one to come out. They're talking the end of August, beginning of September, right around when the flu doses start coming. It's still, they haven't really said much as to if it's gonna be one dose and then another dose for high risk, or if it's just gonna be a single one and done and wait till next year. So,
Thank you, Chelsea. All right, Shelby, for health education.
All right, hello. We've been pretty active with the summer camps this year. It's really exciting to see the kids. So we take the hand washing tent out so they can see that. So thank you, Mike, and for your staff for helping out on that. I know they do all the heavy lifting. Same thing with the brushing teeth. So I created a little printed out piece of paper with teeth on it, laminated it, and the idea is for kids to draw with an Expo marker germs on the teeth so they can kind of see that they need to brush a little bit harder than what they actually normally brush. To them, it's arts and crafts, so it's like fun for them, and educational. So those two have been really fun at Deming Park. This past quarter, we did do the Vigo County Health Department Health Fair with over 18 vendors, and we had some special activities going on throughout the day too for people and employees to attend. We partnered with the Juvenile Center. We created 5 little kits for their rooms. It's not an examination room, but similar to it, and they have Narcan in them. So each room has their own Narcan. And education on how to administer Narcan and when to come back to me, and I will restock it once it's expired. Sullivan County Health Department has finally gotten a public health educator. So I went down there for the day and kind of gave her the rundown of what we do here in our county and how she can use some of our help to assist her and stuff like that. And she's very excited to bring that down there as well. Coming up, I have some fun things at some assisted living facilities. They asked for a presentation, and I wanted to make it a little bit more fun and extra, so we're going to do hygiene bingo with them. Who doesn't like bingo? And then the We Live Health Fair with Hamilton Center will be coming up, so it's going to be a busy summer.
And the lineup for the Dancing with the Stars was announced, and our Shelby Jackson is one of them.
Oh, congratulations. Great.
Shelby, this is the most activity I've ever seen, I think.
It's a lot.
You've done a great job, thank you.
Thank you.
Thank you very much.
Any questions? All right, thank you guys.
All right, Amanda for environmental.
Hi, guys. So environmental's past 3 months has been super busy. Summer started off with a bang with all our fairs and festivals. I think we did around 95 temporary permits. So those 95 places were inspected, along with keeping up with our routine inspections. Septic systems are in full swing right now too. So the installs on those, replacements, updates, whatever needs done in that aspect. Contractors coming in daily to get requirements and meet with Steve and Cheryl and Anna. Let's see, we survived the air show and the fair and Banks of the Wabash Festival. Those were our 3 major ones that we've had here recently. We've been working with Inspectigo, which is our new program. I say food program. It's actually our new program for septic, food, tattoos, swimming pools, and our general complaints, where everything will be put into the data, a system, and electronic inspections will be done. So we've been working hand in hand with them right now it's about every 2 weeks, getting that system built and going from there. With that, the interns that Mike had have now switched to our office, and they are helping with the data entry part, because we have over 10,000 septic permits that have to be data entry, along with the new ones that are coming on daily. Let's see. I have 3 inspectors that are getting ready to go next week to lead training. So hopefully, if everything goes well, we'll have 3 new lead risk assessors in the next couple months. And then I was selected to become standardized, and I'm 1 out of 8 right now in the state that should be standardized under the new food code, by December. And then that will be a trickle-down effect where the state standardizes us, then we have to standardize staff, and then possibly surrounding counties. So, that's our division.
And congratulations, you're new business. Any questions?
So we were able to, through the council's gracious appropriation, get another XRF to do lead testing. And because we're so fortunate to have so many resources in Vigo County, we've told the other counties around us that our other one that we've had resurfaced, that they can borrow that one. So as long as they become certified in how to use it, it's a very beneficial tool in doing the environmental assessment on lead.
Yeah, that's great.
Thank you.
Thank you, Amanda. All right, Loretta with Vital Statistics.
Hello. Don't have really a lot to report, but with kindergarten roundup coming, we have seen this week a lot more parents coming in to get birth records, more than we did see last year. And we also have seen a lot more people coming in to get birth records to start traveling. So that's up a little bit. Brooke did travel to Fishers, Indiana to go to spring conference on April 19th for the DES system, just a refresher on that. But honestly, that's about it. Do you guys have any questions? Yes, we did. I announced it last week. She couldn't be here. We did have a new full-time. I announced her last time we was in here, Maddie, but she couldn't be here. She went to sing at the church tonight. So hopefully next time she'll be here. We can have her stand up. She can say hi to everybody.
That's great.
You guys have any questions?
Yeah, I have one, Loretta.
Yeah.
On the vital statistics, when you're looking at suicides and overdoses, you had 3 and 2 for those. Has that,
Out through the 3 months.
yeah, is that normal? Is that low? What is that compared to, like, previous quarters?
We get, go ahead, Brookie, come on. We get that through the corners.
Okay. Gotcha.
Do
So
you,
you only know about them if the overdose goes through the coroner? Or,
we,
gotcha.
we would see them on the death certificate.
Okay, that's how you, found it. Okay.
Are you wanting to see anything else on the report? We just don't put a lot of information on the report because it's advertised, and there's some things that we just don't wanna.
Yeah, absolutely. No, I think the numbers are fine, yeah.
The
Just the-
program is
just the
escaping me
numbers.
that Molly and I have access to that shows us what overdose activity is going on in Vigo County. Doesn't show the suicide. Maybe Molly can remember what it's called, but you have to kind of do a background check and all that stuff, but it tells you pretty much everything that's going on within your district.
But overdose is not a category on your death certificate, correct? It's homicide, suicide, natural causes, accidental. So it's not, the physician does not put overdose on a death certificate. It's. So what would it, I never had to do that. I don't know what you put. What is the cause of death? The legal cause of death.
But I can say, looking at the state maps, our opioid overdoses, we're kicking tail over here. I mean,
Yes.
it's really, you all have done amazing work, and our recovery community has done amazing work to try to solve that problem, so. Now, obesity and chronic disease, we've got a little room to grow, but,
Yes.
yeah,
But
definitely.
if you guys wanna see anything else, let us know. I mean, if you wanna see anything else privately, email, okay?
Thank you so much.
Thank you.
And to factor in, Dr. Caddick, what you were asking about the HIV and the STIs, I do know that Shelby has an upcoming meeting for the group that she meets with quarterly because of us exceeding our threshold of newly diagnosed, which are IV drug usage
Right.
related. So she does have that coming up with community stakeholders.
Okay, thank you. All right, Molly, social services?
Hi. So I wanted to start out by introducing Larry, our new peer coach.
Oh, great.
We just added him last week. And since we've talked, we've added a couple more courses inside the jail. Those are criminal and addictive thinking and alcohol and other drug education. And we are still doing the MRT, relapse prevention, and peer coaching. The number of individuals that we peer coach currently is 30. The number of individuals who I have enrolled in insurance, I think your page says 32, but it's now 39. Relapse prevention completions is 42. MRT graduations is 44. And on here, I had updated the criminal and addictive thinking completions. I had the 45 up there, but when I redid this, I forgot to erase that, but that's actually 123. And currently, the individuals that we have in MRT are 126. The jail population is 363 currently. And there have been 6 people who have been released from the Vigo County Jail that we are following and are doing great so far.
So how do you do that?
So.
Phone calls or?
Yes, so they have our phone numbers, not just our work number. I mean, we give them our personal cell because, you know, that the first 6 months of them being released, they need a strong support system and someone that they can get a hold of at any time they need them. And so we do that for them. Some of the guys are in work release. In the first 30 days in work release, you can't leave, you're not taking classes yet, nothing's going on, and they really struggle. And so I've found the first one, and he's actually agreed to come speak in one of these board meetings if you guys would like in January, the first one that you guys have. I set that date because it'll be about a year from his release. But anyway, so he really struggled the first 23 days, and I'm not sure that without having that connection with us, honestly, that he would have made it. It's a challenging environment. It's a great thing that they're doing. It's just challenging for them. So
How do you do this? Is there a big conference room and everybody comes like a classroom or?
at the jail, yeah. So we go into the jail. We have a set schedule. We go to the custody officers and we say, okay, we need block A for class. And so we have them separated by blocks. And then we have our class, it's about an hour long, and then we release them.
So do judges look at this, does that have anything to do with how quickly they are released? Does that participating in these programs play a role?
Yes,
When they go to
yes.
court?
Nothing's like set in stone, like if you take this program, you're gonna 5-month time cut, anything like that. But they've definitely been taking it into consideration when they do their sentencing. So we go and advocate for them at their court hearings, and then a lot of times we'll be subpoenaed, and so we'll have to get on the stand and talk about their progress, what they've worked on, you know, why we think that this is gonna work for them now when they've had other chances. And, you know, most of the time, you know, I let them know that, well, they didn't have a support system like they do now. They don't have us. And I'm not saying that we can move mountains, but sometimes if someone just has one person that believes in them, then they can, you know, live their life the way they should and not the way they were raised to live it, if that makes sense.
Do we have any like percentage of recidivism or any kind of number we track locally or statewide? Or how many people come back in? Is there any number like that?
I don't know that number. I don't know that it's tracked.
It's a real issue though.
It is definitely a real issue, yeah. So there's only been 2 people that I know of that they didn't finish our classes, but they got released and then got rearrested. 2 since we've been in there, so. Yes, so it is in the jail, and then I also go on Monday evenings and I teach in work release. And Larry is going to start working with the juveniles as soon as we can get the ball rolling on that. He's going to do peer recovery services hopefully in there, and we've got meetings set up so we can talk about that and have that conversation. That's the plan, because, you know, it starts, you know, at that age, and if we can get it there, then hopefully we can prevent them from going into adulthood.
What do we do about your wellness and your peer recovery coach's wellness? Because being on call 24/7, I mean, and helping
Yeah.
people, it can eat your soul and take your time away.
It can, so, you know, we all have our different things that we do for self-care. It is important in this field. That's one of the things, so not to jump ahead, but we went to a RISE conference, and they had a breakout session with all about self-care and stuff like that, and I learned a ton of stuff, especially the supervisor role, to look out for and to make sure that my people on my team are doing, you know, the right things, and meaning self-care wise and stuff like that, because it's a real issue. It can be. So I just try to be real vigilant, and you know, and I know they do as well. And all of us on this team, you know, have worked in this field for several years. I mean, not that that matters a whole lot, but we kind of know already that burnout's a real thing and that it can come in a second. So, yeah.
I was kind of curious, do you ever look socially, as people register, high school graduate, are they literate or not? Or do you take any kind of when people enroll to see where our challenges really are, that these are mostly high school dropouts, or?
Well, we have
functionally
started
illiterate?
asking those questions. You know, going into this, we weren't sure, you know, what to follow or what questions to ask. So that is one of the questions that we've started asking, and the number is pretty high. And then another question that we've been asking is, how long have you been in the justice system? And that number is extremely high as well.
Including foster care and all that?
Yes.
Include that?
Yep.
And I believe I've shared this before, so I'll make it quick, and if I haven't, you'll learn something new. But when we toured the federal prison, the person that was over education was actually an elementary education teacher, and she didn't understand why they wanted to hire her. And then she realized that literacy factors into the type of crimes that people commit. Out in the maximum security part, it's usually about a 4th or 5th grade literacy level, their high school level at the FCI if they're lucky. And then she said you go out to the farm and they have, you know, degrees that she would dream of having, like, you know, lawyers and doctors and things like that. But I just found that very, very interesting, that there is that correlation between literacy and crime.
Some of the other stuff that we've been working on, along with getting into the juvenile center, Dr. Ken Massey, I've had meetings with him, and he's agreed to do some aftercare for these guys, and try to get them connected to a primary care physician, like not long-term, but short-term, so they can make sure and have their medicine. And I know that I'd mentioned that the last time we had a meeting, because I really believe that that's, you know, a big issue here. And so I thought that was really cool that he volunteered to do that. And I was told his mother worked in the Vigo County Jail as a nurse for a long time, so I didn't know that prior to him, you know, telling me that. Another thing that we're working on is collaborating with Intrepid Phoenix Fitness for Recovery program, Recovery Court, as well as Drug Court is interested in getting their participants involved in that. Fitness for Recovery is a program that was designed by an alcoholic who, after changing, you know, his habits from drinking and all the other stuff, he started working out and moved all those bad habits into good ones. And, you know, over the years, there's been statistics that if you work out and you're doing some kind of activity, the relapse rates go down and your chances of relapse lower. And so I thought that was really cool that we're getting to do that. I already talked about work release and being able to teach there and mentor in there some. Very thankful for that. Oh, this is a big one too. The jail commander and the matron at the Vigo County Jail, we've been having meetings about building a recovery community inside the jail. And so while they're taking the classes and in the program, they're all together working toward the same goal. And so as they go back to their block, they're not fighting to survive when everybody's doing all the wrong things. They're able to work on stuff together and, you know, move toward that goal to be better. Because that's a real thing too. you know, it's a difficult population to serve, and it's difficult for them to be focused and do the right thing when everybody around them is doing all the wrong things. And so I'm super excited about that. We've also been asked to do the substance abuse education training for the West Road Police Department. I'm doing that Saturday at 10. I was super excited about that too. Glenn Brock reached out to me and asked me if I could do it, and Dr. Todd has been helping me this week get stuff together to be able to do that. So, do you have any questions for me?
Yeah, I have one,
Okay.
and I appreciate what you guys are doing so much. I think this is so intriguing and such a feel-good type of thing for our county. When you have these statistics, I think it would be amazing if we could look at these quarter to quarter from the time you started until now, just for justification on the work that you're doing. And I think it would really kind of spread itself out and show exactly what you're doing. Second thing is what's your bandwidth now for accepting people with the current group that you have? Do you have availability? I mean, how much more can you expand?
Inside the jail, like in our classes. So our classes can't be over like 15 people. So we can expand, I guess is the answer to that,
Okay.
yes. I don't know that I have a set number. I know that we can, all of our classes can hold 15 people, and so there's been a couple times it's been over that, but you know, the women population in the jail is really small compared to the men, and so our classes for women are like, I had 3 in 2 classes today. I had 3 in one class, 2 in another. And sometimes our numbers are shifted also because they send them out of town. I've had them be in class almost up to the end of it, and then they got moved to a different county because of overcrowding. So we're trying to figure that out too with the recovery community. I think that'll help with that.
So if this would expand, has this been done in other places where there's actually a step down from your team to another level? Is that like where you're attaching them to primary care, or is there another, in other places where this has been done on a larger scale, is there a step down where they would go to maybe another team after your team works with them?
So I'm not exactly sure about that in another town or whatever. I know that we have the social services, the case managers in the courts who are helping us transition them, and then if they struggle with housing, they're helping them with housing and all that kind of thing. Is that what you mean? And then
Yeah.
kind of have different branches of barriers that can be removed by different people?
Yep, that's exactly what I mean. I'm
Yeah.
just looking at I know this is HFI funded, and so looking at this going on for years to come,
Yeah.
and as it expands and being an outreach for our community, I just want to make sure we have plenty of people coming in to help
Yeah.
on the backside for these people like the gentleman's going to present. You know, will he still have, if your team's super busy, is there going to be someplace else he can go in our community?
Yes, and the
Yeah.
interesting part too is we're bringing on an intake coordinator come January, which then they'll assess that person's needs. And the interesting article on the Hill website, The Hill, today, and it's from a fellow who was incarcerated for over 15 years in prison. I never even thought about food insecurity when people get out. I mean, you think of other things like a job or transportation, but so many of the programs that they're denied. And it was before our budget hearing yesterday, the Public Defender's Office was there, and they had a person who was successful from their program. Now, keep in mind, we're partnering with the courts and public defenders, and Janet McBride's one of the licensed clinical social workers, and she was there. They had a person who was successful, and it was just interesting. This person had lived in garages, drug addiction, in and out of jail, but just to have someone believe in you, but having that moment where you know that you can trust them and they help you with your needs, to where now she has a job, she has a safe place to live. I believe working on or has her children back, but there is another team, another level. That's why we started with Lucky and Chances for Youth and the school corp with the kids, Molly and her group in the jail, and then the judicial part in Public Defender's Office.
Yeah, I almost see synergies coming from after these these people go through that program, and they go through the chronic disease program, and how we wrap services around. I mean, so, like food and security, that's something we deal with all the time with chronic disease.
Yes.
I mean, so they're all gonna come into this pool where hopefully we'll have resources available that we can share across all these different aspects. But I really appreciate your report, Molly.
Thank you.
Great work. Is there any citizens' input? All right, I think that's, oh, Councilperson Dees, do you want to say something, or Councilperson Penn? That group, yes. All right. Anything else for the good of the cause? Thank you all very much for attending the meeting. Do a motion, do we do a motion to adjourn?
So moved.
Think, sure. All right, we'll do it. Thank you.
I wanna get in the minutes.
Second.
Thank you. Did a good job, thank you.
Amanda, question. That lady that was about the mold thing, did you get on that? Where do people go with that? And since they're over in Indy, I mean, that's, yeah. Oh. How could you not do that? But she said she did. Okay. To who? Okay. Could be personal responsibility. I mean, you don't know. Yes. Hot, yeah.
Yeah, I'll let you know. That might be I loved your post about.
I see. It's hard to tell where these people are going with all this. It starts with something. Oh, you get. Yeah, you need to see her both sides of it. There's always three sides of everything. You're doing that. Yeah. You don't know if they want free rent, or you don't know what their intentions are, or anything. Ah. Oh, yeah. That's that'd be awful trying to be a. No, I mean somebody renting things out to everybody right now.
Okay.
It's gotta be awful. Then they don't pay, then they got up to 6 months, they don't pay you. Oh my gosh. Then you got people squatting. How does that happen? You should, I don't know. I've heard people going in and squatting on the squatters, but it's your own place. I mean, how in the world does that happen? Well, then, I guess the only way to get rid of it would be to sell the place, and then they have to kick them out, don't they? Well, there's going to be a lot more of it. Yeah.
Thank you. I really appreciate your support. I never thought I'd see the day. You know, it's
Oh, there's your problem. Oh. Does he know the cats are in there? A lot of times they don't even know that stuff's in there. Oh, oh my.
It's called Rage of the Unloved. And,
She probably was afraid somebody would find out she had the cats in there. I can live with 20 cats. Oh,
thank you.
oh my.
So,
It's almost dangerous for you.
yeah, Rage of the Unloved.
How does you have to have a bodysuit to go in
Yeah,
there.
yeah, right? Yeah.
Hazmat or whatever.
That's really cool though.
Probably have to have a respirator on when you go in there.
Can you read that? Rage of the Unloved? Okay,
Alrighty, I will.
Oh,
yeah.
sorry, you gotta deal with that stuff.
I can probably get one
I
and get it
know,
to you.
but
My sister has
appreciate
some
you
at her house,
being there,
but
that's for
you
sure.
can get it on Amazon. I don't know if they have it at Books A Million. Yeah, I'm not sure, but I can probably get one if you.
I agree. I totally agree with you.
Oh no, you don't have to do that. No. You don't have to do that. No, I'll just get you one. Don't worry about that.
Yeah. Well, thank you. Appreciate it.
Okay, I'll get it for you.
See ya.
And I'll get it. Okay, all right, sounds good. I'll get it tonight. But, thank you, yeah.
You don't know?
I bet that was interesting. Right, right, yeah. Right. No, yeah, and their rec time is not, like, they have a rec room, they don't have any equipment or anything, all they can do is walk around, I don't know. I mean,
I've seen it before, it's really cool.
it is, yeah. These guys are soaking it all up,
So that's fine, and then we'll talk about it.
yeah. I can't wait I'm gonna watch that tonight.
Yeah.
Right, yeah.
She can't come on
Right.
weeks or separate, just to talk about our patient.
That has all the resources and websites. So they can present some.
That needs to be on this website next to this.
Right, right. Right.
Maybe that comes to the meeting to talk about resources or.
Yeah, yeah. Right, yeah. Yeah, yeah. Thank you so much, and I'll give this to you tomorrow. I'll get Joni to get it to you. Absolutely, yes, absolutely. That's right. Thank you.
So they track their feet to get you out of the county, taking the state.
Now you get your stuff in order, and you have 30 days when the person is sentenced to get them into
Sharon, is that we hear the impact health department has made all over the county. It gets so frustrating when you see, like, some of the other ones, it's just, why aren't you guys collaborating?
That's
Why aren't
right.
you doing some of this stuff, you
We're
know?
one, we all are working towards the same thing, and that's to serve
Just
the
like
people.
today, we had Parks Department, so the Parks, we mentioned about the parks, we had the judges in there, we talked about that, we had the Sheriff's Department, we talked about that again, you know, so we see all those impacts.
And we have opportunities that others don't have, and that helps us
Yeah.
be able to
And maybe
give it out, because we've got food that we need. I told them. Stop working on it because you too, anytime you wanna come observe what they're doing, take some time and slide down.